70 to 120. And while the insulin shots, along with the constant monitoring of his blood sugar levels, do keep the diabetes in check, waiting so long to get treatment did serious damage to Matt's body. He suffers from a syndrome known as neuropathy, a painful form of nerve damage.
So basically what has happened to me is I've got neuropathy in my feet, and I've also developed neuropathy in my scrotum. Since I've began treatment, I would say I'm able to maintain a proper erection 90% of the time, which is a big improvement. The neuropathy in my scrotum seems to be getting better with treatment, so that's really hopeful there. I guess if I were to ask Dr. Drew anything, it would be, how does diabetes cause this, and will I ever make a full 100% recovery, or is this something I'll be dealing with for the rest of my life?
Well, I'm sorry to say, Matt, your sexual functioning may never be 100%. You know, what happens with diabetes is that it affects the vascular supply and can cause permanent damage to the nerve endings in the genital area, resulting in erectile dysfunction. And, you know, you've been experiencing that. And will it get better? Yeah, I mean, you're seeing that it gets better, but unfortunately, probably not 100%. The good news, though, is we live in a time when there are effective treatments. Think of that, like Viagra, Cialis, Levitra, and others that can treat this problem quite effectively. It's important to note, however, that diabetes isn't the only condition to watch out for. For instance, heart disease. The initial manifestation of heart disease sometimes is a change in sexual functioning, particularly erectile dysfunction. So be aware of any changes of the phase of any part of sexual functioning, whether it be libido, arousal, pelvic organ response, it affects libido, erection, or even achieving orgasm. Such changes in sexual function can be the initial manifestation of almost any medical condition. So, see a doctor. You'll hear me say that a million times. Problems with your sexual health may be alerting you to an infectious disease, a heart condition, even cancer. Know your body and don't ignore the warning signs. Coming up next, a VJ from MTV2 shares his battle with a debilitating disorder when Strictly Sex returns.
Very comfortable with my body, so I don't think I would change anything.
If I could change anything about my body, I wish I was taller. That's it. I'm happy with my build, my looks, happy with everything but my height.
If I could change anything, I'd be Brad Pitt.
I'm happy with my sex life, and I wouldn't want to change my body in any way.
Welcome back to Strictly Sex. Tonight we're talking about issues that make us ask ourselves, am I normal? 90% of people say if they could change a part of their body, they would. But what happens when someone's insecurity turns into a life-altering obsession? Joining me is Dr. Jamie Fusner of UCLA's Neuropsychiatric Institute and MTV2's VJ, Chris Tronsden, to help us explore a very serious subject, body dysmorphic disorder. Dr. Fusner, Chris, thank you guys for joining me.
Thank you for having me.
Dr. Fusner, what is BDD, or body dysmorphic disorder?
Body dysmorphic disorder is a psychiatric condition where people have a perceived abnormality, that they think that they have something wrong with a specific aspect of their appearance, and they're preoccupied with it. They obsess about it. They can't stop thinking about it.
How does that differ from sort of what we might call normal preoccupations about losing weight in certain parts of your body?
Well, I mean, as that statistic says, it's very common for people to have something about their body that they don't like, that they think is, that they'd like to change, or they would, kind of dissatisfied with. But this is different. It's a matter, first of all, of degree, that people have, the concern is something where they cannot stop thinking about it. They're spending hours every day thinking about their appearance, wishing it could be different. And in addition to that, they will do a variety of behaviors, compulsive behaviors or avoidances in response to that.
Chris, you had this condition?
Yes, I did.
Sound familiar?
Everything you said, yeah, is right on.
Can we ask what you did?
For me, it was just abnormal thoughts that just didn't make sense. I thought I was balding. I thought I had a humongous nose. I thought I had scars all over my skin, over my face. I thought that I had really bad skin. I just felt like there was something physically wrong with me.
What did you do in response to all that?
I mean, hours in the mirror trying to figure out, I mean, as crazy as which colors or which lighting situations my skin would look the best in, or how I could wear my hair to cover up my receding hairline. Just do physically different things to try to camouflage it or make it less, bother me less.
What causes this condition?
Well, it's a good question. We don't know exactly what the cause of it is, but we have some clues as to some of the things that are involved in how body dysmorphic disorder comes about. And it seems to be related to something called obsessive-compulsive disorder.
Is it always a part of OCD or obsessive-compulsive disorder?
It's not always part of it, and it's common for people with, relatively common for people with body dysmorphic disorder to have OCD. It's about 30% of cases they will also have OCD.
Chris, you compulsive?
Yeah, of course, because well, I mean, with this disease, it was. I felt like I had to have a regimen. I felt like I had to do certain things. So
do you have rituals you do every day?
I had so many rituals because I felt. I mean, it was as crazy as I thought. Like my water was affecting my skin. I had to shower a certain place. I mean, it's just everything in your life becomes. Trying to cover it, trying to hide it, trying to fix the problem, and so I would go through routines of things that I thought would make it better.
Dr. Fusner, how do they treat this?
For most people that have moderate or severe and even mild body dysmorphic disorder, they benefit from having a specific type of therapy called cognitive behavioral therapy.
Making them change their thinking about this a little bit.
Yeah,
helping them
change their thinking, but also having them do some behavioral exercises to start to decrease some of the behaviors and avoidances that they've been doing as part of this disorder that maintains it.
And then this is, in my practice, we usually use the serotonin reuptake inhibiting medications. Like Prozac is one of the most powerful medicines for OCD. Is that what you guys are finding?
Yeah, all of the serotonin reuptake inhibitors seem to work about equally well.
So one of the things about the serotonin drugs is they can diminish your sex drive. I imagine this condition, Chris, already screws with your relationships.
Oh, it messes with your head because you're so focused on you. It's like you're embarrassed. You don't want to have sex with someone because it's kind of putting all your guards down, and you're one-on-one with someone and you feel like they can see everything that's wrong with you and you're more focused on that.
Dr. Fusner, is there one thing someone who's listening or viewing out there can sort of look at as a threshold to determine whether or not they really need to see somebody about this or whether this is just sort of normal preoccupation in today's culture?